Hello, my name is Dr. Allen. I'm a GP at Burley Health Centre. So today I wanted to introduce Rachel. She's our pharmacist who works in the practice. There's been lots of change with new roles coming in, and this is just an opportunity to help you to understand a bit about one of those new roles.
My name's Rachel. I'm the clinical pharmacist based here at Burley. You also might see or speak to clinical pharmacists at other local GP practices, for example, Crystal Peaks, Hackenthorpe, Owlthorpe, Southall or Mosborough.
So people will be familiar with community pharmacists that work in pharmacy buildings, but you're working here in a GP surgery. So can you just explain a bit about kind of what you do and how it's different to the role that people will be used to?
As a clinical pharmacist, most of our work involves medication reviews and medication queries. So we might phone you for a routine medication review. The purpose of this medication review is to make sure the medicines that you are taking are helping in the way they should do and that they're safe and appropriate for you to continue to take. This might mean that we discuss with you making changes to the dose of your medications and even making changes to the medications that you're prescribed. This is always done with you, the decision's always made together.
Great. And so that's an example of where you might contact the patient. When there's kind of some scenarios where they might contact the surgery and they get, but it's you that helps to resolve the problems. Have you got any examples of when that might happen?
So if you contact your GP practice with a medication query, it's likely that their clinical pharmacist will resolve that query. So some examples are any problems or questions relating to your repeat list of medications, what we have on your GP records, any recent changes to your medications that the hospital might have done, or any specific medication questions that you have just in general about what you're taking.
Yeah, okay, great. What do you feel kind of a pharmacist adds to the team?
So clinical pharmacists are basically experts in medications. We've got time to have consultations with patients, to discuss medications in detail, to support how you take your medications and make sure you get the best out of them.
Mm-hmm. What do you most enjoy about the role?
So I enjoy making a difference to how patients take their medications. I enjoy being able to provide advice and help to patients who need it, any questions they've got, to help them take the medications and be happy with taking them and getting the best out of them. I also enjoy cardiovascular is an interest of mine. So I specifically speak to patients about their blood pressure. So I might contact you for a review to review your blood pressure, and aside from talking about medications, we might discuss how your lifestyle can affect your blood pressure, so things like diet, your exercise, smoking, alcohol, your weight.
Yeah, so it really is, there's lots of, I think it really brings lots of extra skills to the team, and I think the other thing is that you support us with kind of decision making when things get very complicated, but also like how we look at the systems of how we manage all our patients' medications together. So I think it really helps the practice to function really well with how it does its medications, and I think that it'll continue to improve over the next few years, partly because you're here. So it's great to have you on board.
Brilliant, thank you.